As many of my patients know, I already have had two procedures before. One in 2007 and the other one in 2012. All this is planted hair. I say this to tell you that when a patient enters a doctor's clinic on the day of the procedure, in many cases his heart is beating so fast, it actually comes to your mouth. There are some patients who feel so panicked that they want to run away. Well, that is an extreme. But most patients feel nervous when they come to the doctor's clinic just before a hair transplant. Howsoever much strong they might be, howsoever much strong-willed they have been, howsoever many surgeries or howsoever many anesthesias for hair transplant they may have undergone in the past. Well, this is natural. This is the body's response to an event. And if it is within normal limits, it's very normal and nothing to worry about. The only problem happens in some patients who are hyper anxious. In those cases, it becomes a challenge. Anesthesia becomes a challenge. The doctor must be sensitive to the feelings of a patient who walks into the clinic on the day of the procedure. Every single word that you say or your team says, the behavior of your team, every sight and sound and even smell, every grimace on your face, every single facial expression on your face is being recorded and is being noted by the patient. And if this is not appropriate, it adds to the patient's anxiety. A clinic should give a calm and a professional look, which is not very daunting on the patient. For a bad experience in a hair transplant is like PTSD. It's like post-traumatic stress disorder, which if you relive even once, the memory of this unpleasant event keeps coming back in your mind again and again and again. And patients who have gone through an unpleasant experience in the clinic as far as anesthesia or pain is concerned are not likely to return for future procedures. The phrase "more pain, no gain," if said to a patient even jokingly by the doctor, is a very harsh, a very crude expression. Mind you, the patient might laugh it away, but it's occurred in his mind that this procedure is going to be a painful event. There are over 50 different regimes to manage pain during the procedure. They vary from doctor to doctor, personality to personality, country to country, and also reflects the training of the doctor. Which specialty has he been trained in? Is he a plastic surgeon? Is he a dermatologist? Is he a dentist? Or a gynecologist, or many others? There's so many fields which have encroached upon the field of hair transplant surgery, as you all know. So the approach to painless surgery differs from one field to the other. The approach is also limited by the type of facility that the clinic is in. It is only accredited clinics which have legal sanction, which are allowed to give sedative anesthesia, long-acting anesthesia, inhalational gases. Many clinics are situated in commercial centers, in one-room or two-room setups. So these are the clinics which do not have the sanction of the local authorities to give anesthesia which is relatively pain-free, because for this you have to have an accredited center. So these clinics will only give oral medication and local anesthesia. My grounding and training is in the field of plastic surgery. Most plastic surgeons use bupivacaine and lidocaine in various combinations for local anesthesia. Over the years, I have found that the addition of bupivacaine is not without danger. Bupivacaine is a strong drug for local anesthesia. 0.25% bupivacaine in rare circumstances can cause irreversible arrhythmia and fibrillation. Therefore, in my clinic, I only use lidocaine 1%, freshly mixed with 1 in 50,000 epinephrine. However, in cases where the procedure is likely to go long, more than 8 hours or even 10 hours, in those cases, I do supplement with bupivacaine and not otherwise. There are many clinics which go even a step further by giving various drugs like inhalational anesthesias, nitrous oxide, fentanyl, propofol. Well, I have tried almost all the agents over the last 15 years since I have been in hair transplant practice. So my regime of anesthesia towards a painless procedure is a product of my experiences, my trials, tribulations, whatever you might say, over the past 15 years since I've been practicing hair restoration surgery. So this suits me best. It suits my setup, which is an accredited medical center, as you can see. It suits my center, my personality, my training, and my patients, along with my team, the best. And it comprises In short cases, that is cases which last up to 6 to 8 hours, 1% lidocaine with freshly prepared 1 in 50,000 epinephrine. In selected patients who are a little anxious, whose heart rate is more than normal, I would like to allay their anxiety by giving them conscious sedation. Level 2 conscious IV sedation, lasting only for about 10 minutes, 15 or 20 minutes at the most during the course of the injection, so that the patient does not have a bad experience during the injection, which at times patients do experience or recall as painful. So what is my protocol? What is my regime for managing a patient, giving a patient a painless anesthesia for hair transplant? In patients who are coming in for mega sessions, I may like to mix 0.25% bupivacaine or sensocaine in the anesthesia so that it has a prolonged action. Whereas lidocaine has an action of only about 3.5 to 4 hours and needs to be fortified, topped up, bupivacaine gives an action of up to 7 to 8 hours after the procedure. So this is the advantage of bupivacaine, and we use it in mega sessions. We never use bupivacaine in cases who have underlying heart problems or patients who are elder than 60 years of age, because bupivacaine, as we all know, can cause, in a rare event, irreversible arrhythmias and even at times fibrillation, which may be difficult to control. When a patient is hyperanxious, sometimes even bordering on panic, in these cases I like to give level 2 conscious sedation using various combinations in my clinic under the supervision of a competent anesthetist. This process of conscious sedation only lasts for the duration of the injection in the donor and the injection in the recipient area. It might last a little longer in some patients, up to about 30 minutes or so, but mostly the patient is awake. Why do we want the patient to be awake? The patient has to be awake so that he has trust in your practice, so that he can contribute to the final hairline design. And in times of malpractice, which is so common now in the field of hair restoration surgery, he also feels calm and composed if he knows he's in the right hands, if he knows that what has been promised to him as far as who will do his harvesting, who will do his slit making, and who will be supervising is being implemented, and he is being offered what he has paid for. A person who's deeply sedated will also not allow you to position him properly. He might keep moving, and since this is a delicate procedure done under high magnification, a little bit of movement will increase the operative time, and low operative time is the crux of the whole procedure if you have to have grafts which are viable and grafts which will survive after hair transplant. So this is the reason why we give only level 2 conscious sedation, and we do not give our patients propofol, fentanyl, ketamine, or even inhalational gases like nitrous oxide, because these take away from the trust of the patient, and also they are inimical to the process of hair transplant because the patient continuously may keep moving. While injecting the anesthesia, I follow the string of pearls pattern. This string of pearls pattern creates wheels or blebs at intervals of 4 centimeters along the donor area and then the recipient area, and through these anesthetized portions of skin, in a pain-free manner, the anesthesia is extended away from these blebs or these wheels. So this string of pearls ring block aids in painless anesthesia along with IV sedation in selected cases. In short cases, as I told you, 1% lidocaine with 1 in 50,000 epinephrine solution, which is freshly prepared, is used. Since it has a duration of action of only 3.5 to 4 hours, it needs to be topped up. So after 3.5 hours to 4 hours, we top up the donor area and also the recipient area before the patient goes to the hotel or when he goes to his room. To be noted here is that the solution has to be freshly prepared. If it is not freshly prepared, and if it comes with pre-mixed epinephrine, this solution is pre-made or preset to an acidic medium with pH 3.5 to 5, and injecting this may cause severe pain. Whereas if it is mixed with fresh epinephrine, the pH is almost neutral. Also, the pain of injecting anesthesia is also diminished if we add a 9:1 mixture of soda bicarb, which gives a pleasant experience even while the anesthesia is being injected. So what are the essential points towards a pleasant, painless experience during anesthesia? Number 1 is that I pre-medicate my patient the night before and the morning of the procedure with a mild oral sedative. Secondly, a short-acting level 2 conscious sedation is given in select patients. Number 3, adequate tumescent anesthesia is used in the donor area as well as in the recipient area so that the skin comes away from the underlying neurovascular bundles, the bundles which contain the nerves and the vessels. So the irritation or injury to those bundles is avoided. This tumescent anesthesia reduces post-operative pain. It is also very essential to take advantage of the gateway theory of pain. The spinal pathways of pain can be compared to an highway in which only a fixed number of lanes exist for traffic to ply. If it is a 5-lane highway, only 5 cars can go alongside, 10 cannot go. So in this gateway theory of pain, if you bombard the spine with more impulses like pressure, touch, cold, vibration, the effect or the flow of actual pain to the brain and being interpreted as pain is far less in quantum than it otherwise would have been. So most clinics practice this form of application of cold and vibration and deep pressure while injecting anesthesia, and it helps the patient in having less pain than he otherwise would have. Then buffering the solution, anesthesia solution, with soda bicarb to increase the pH value, using small size needles, 30 or even smaller needles for injection, reducing the rate of injection, and especially in women, applying EMLA cream 3%, eutectic mixture of local anesthesia cream 1 to 2 hours before the procedure. And lastly, as we all know, very important, the attitude of the doctor, the team, the environment in which the patient is, a calm environment, a pleasant environment which is ambient and prevents anxiety, helps in allaying the patient's fears and decreasing the feeling of pain. This is what most clinics forget, and which is, to my mind, a very important part in alleviating pain in the patient who's anxious. So what do I avoid doing during the process of anesthesia? I avoid giving deep sedation in forms of fentanyl, propofol, ketamine, or inhalational anesthesia like nitrous oxide. I avoid giving bupivacaine. I also avoid nerve blocks, which are very common in some practices. I would like to wind up by saying that a clinic can give pain-free anesthesia if it is an accredited unit which can give various forms of anesthesia like inhalation anesthesias or even deeper anesthesias as the case may demand. A clinic which has the constant presence of an anesthetist to manage the eventuality of a rare event, a rare untoward event happening. A clinic where close monitoring by way of recording his oxygen concentration, his heart rate, his blood pressure, and even his EKG. A clinic which has life-saving measures like defibrillators, various medications available to counter a side effect like anaphylaxis if it happens, which is a possibility. So providing a safe environment, a pleasant environment, a pain-free environment is a pillar in the process of hair restoration surgery. Due importance to be given to this important aspect. If you may have any questions about painless hair transplant surgery or the type of technique that is in my institute or in various other institutes, or you would like to have more in-depth knowledge about anesthesia and hair transplant, do drop me a comment and I'll be very happy to answer. Thank you for watching and stay safe.